there, my name is Kevin, and today I'm going to give you an analysis of your body to see which areas you might need to work on, or which stabilizing muscles we should work on also to get you to a good level before we start with the physical training. So today, I tell you what we're going to go through. First of all, we have the upper cross syndrome, yeah, and first one is to be checking on your head, whether it's gone forward too much or not, okay? Then I can check on your scapula as well to make sure it is the correct angle and flat, and there's no prominent medial border seen. There's also alkyphotic or excessive curvature of the back, okay? So we refer that as hunchback. There is the fourth, which is the distance between the scapula and your thoracic spine here. Should be about 3 fingers distance away, okay? Yeah, so we've got a fourth, which is your, oh sorry, it's the fifth. The fifth is your prominent inferior angle. So later on I will test to make sure, I will do a test just to make sure there is no prominent inferior angle protruding out from your back, all right? And lastly, for the upper cross syndrome, I will check on your palms as well to see whether it's facing back or not. So this is to determine whether your shoulders may be too rounded, okay? All right, so now we go on to the lower cross syndrome. And this area is to check on your lower half, of course. But let's start with the hyperlordotic lumbar, which is the lower half here. So your curve should not be too curved that I can fit my whole hand past when we do the test later on. Anyway, when you're against the wall. So hyperlordotic lumbar is the first one. The second one would be to check your anterior pelvic tilt, and I'll be able to determine that later when I see the angle of your pelvis. And lastly, the third one is to check that your knees are not hyperextended, because if they're pointing backwards, if you're able to point them backwards, there is something wrong with your knees, okay? So that is the upper and lower cross syndromes. Then I can also test your pronation, okay? So I can have a look at your Achilles tendon aligned with your calcaneus bone. That's your heel bone. That's the first one. Second one, we can have a look at your pronation, whether you have that arch below your feet, okay? The pronation, whether you have flat foot, basically. You got your third, which is the hallux valgus. So I'll be able to check on the angle of your toes to determine whether you have the degree of your toes pointing is past 15 degrees or not. Okay, so that's hallux, and then we got your valgus knee as well. So I'll be able to check from your anterior side and determine whether you have valgus knee. And that's valgus knee is when your legs are turned inwards. So you've got some kind of an X shape, okay, X shape kind of legs when you're stationary. All right, that's valgus knees. What else is there? And then we can check on your anterior pelvic tilt as well. So that's 5. And anterior pelvic tilt, that's what we would have covered actually in our previous lower cross syndrome. There is also now the scoliosis. So scoliosis, later on I'll check whether your spine is straight or not, or it's some kind of a C shape or S shape. All right. I'll also be able to check on your lateral pelvic tilt. So earlier on we determined that whether you have anterior, but there's also your pelvis being able to tilt to the left or to your right. So I can determine that later as well for you. And then from the bottom we come up to the shoulder area. So I'll see whether you have a tilt on your shoulder to one side or the other. And then finally, we check your head. Because the head is actually pretty heavy as well. So if it's tilting to one side, that's not a good thing. And I can let you know that, and you can actually focus and try to maintain a more straight head. Thank you.